BBC One and iPlayer.
A virtual audience asking all the questions now on BBC One with Fiona Bruce.
Welcome to Question Time. On tonight's panel, Mark Harper, former Minister and Chief Whip under David Cameron, briefly in the race to become party leader 2 years ago, Chairman of the COVID Recovery Group of Conservative MPs. Elected in 2019 at the age of 23, making her the youngest MP and therefore the baby of the House, and member of the Socialist Campaign Group of Labour MPs, Nadia Whittome. Layla Moran, Foreign Affairs spokesperson for the Liberal Democrats and runner-up to Ed Davey in the race last summer to become party leader. Joining us down the line from Edinburgh, Professor of Public Health at Edinburgh University, Linda Bauld, and founder and chairman of the Oakman Inn chain of pubs and hotels, Peter Borg-Neal. Good evening, welcome to my guest here in the studio. Linda, welcome to you, joining us down the line from Edinburgh, and of course welcome to our audience, our QT50. Very good of you to join us this evening. Thank you at home for watching, of course. Do join in the conversation in the usual way on social media at BBC Question Time. Let's hear what you've got to say. So let's take our first question tonight. Let's get going with Will Drakes.
Yeah, good evening, everyone. So should lockdown end following the vaccinations of the priority groups?
So you're talking there, Mark, about, Will, about the 9 priority groups, so to the over 50s. Mark?
Will won't be surprised to know that I think the answer to that is yes. We've been very careful in what we've said, the letter that we wrote to the Prime Minister last week, which was very much tied to the rollout of the vaccine, which is going fantastically well, because as you roll out the vaccine, you do what we've got the lockdown in place to do at the moment, which is save lives and protect the NHS from being overwhelmed. So our view is, once you've done the first 4 groups, which we've now done, you have to wait 2 or 3 weeks for the vaccine to be effective. That takes you to March the 8th, which is when we think schools should come back, and that's when you start unlocking. And then over a period, you can reduce the restrictions. And then once you've vaccinated everyone over 50, and actually it's worth just saying it's not just everyone over 50, it's everyone over 50. And the biggest group in that is everyone over 16 who's got a health condition that makes them vulnerable to COVID. Once you've vaccinated all of those people, those groups account for 99% of the deaths that we've had from COVID. And our view is once you've vaccinated those people, reduce hospitalisations by about 80%, then you can remove the domestic restrictions. We still think you'll need international restrictions for a period.
And are you swayed by what's happening in Israel, which of course is going gangbusters on the vaccinations?
Mm-hmm.
And they've vaccinated about over a third of their population.
Yep.
And serious cases of COVID among the under 60s have risen by half.
Well, I think there's two differences there. One is, which is why I made the point, we're not just vaccinating the over 50s, we're doing everybody from 16 to 64 with a health condition that makes them vulnerable to COVID. So it's absolutely true that younger people do go into hospital, but usually, not exclusively, but usually they have some other health condition that makes them vulnerable to COVID, and we're going to vaccinate them. And of course, in Israel, they've got a much younger population than us. I think I'm right in saying that in Israel, I think a third of the population, I think, are children. And so they have a different age mix to us. So I do think you need to look at the data. And of course, we've proposed getting rid of those restrictions from the end of April. And of course, it's worth saying that's 2.5 months away. We are only 1.5 months into this lockdown. So I don't think in another 2.5 months' time, that can really be described as a massive rush. I think it's actually taking it carefully and cautiously in line with the rollout of the vaccination. Of course, if the vaccination rollout slips, our timetable will slip. It's tied to the rollout of the vaccination and protecting people.
Nadia?
Will, I empathise with you. I also hate lockdown. I can't wait to be able to hug my grandma again. I can't wait to be able to go on a night out and to go on a holiday. But the problem is that these 3 lockdowns, the national lockdowns, haven't been inevitable. They're a result of the government's failure, and not just their failure this year, from being too slow to act, from the failure of the privatised test and trace system, but also the failures over the last decade, which have paved the way for this response to the coronavirus. It's because of the lack of investment in the NHS that we haven't had the beds and the hospital staff. It's because of lack of investment in PPE that people like my colleagues and I, at the beginning of this pandemic, were without adequate personal protective equipment.
But coming to Will's question specifically, should the current lockdown end following the vaccinations of the 9 priority groups?
I want lockdown to end as soon as possible, but we cannot prematurely end lockdown, otherwise we will be back at square one.
And do you think that would be premature?
That's what we're seeing, is every time we start to make some progress, people like Mark Harper and his colleagues in the COVID recovery group want to end lockdown and start at square one. So the question we need to be asking is, how can we make lockdown work? And currently, there are many, many people who aren't able to self-isolate because they're having to live off 95 quid a week statutory sick pay. So one simple thing that the government could do is increase statutory sick pay so everybody who needs to self-isolate can afford to, because this isn't just a problem that is going to go away with the vaccine. We know that this virus mutates.
Let me take some points from the audience. Martin.
What does the panel think is an acceptable death rate from COVID?
An acceptable death rate. OK, Andrea?
Well, you know, I was going to say that if we're looking at easing lockdown restrictions, of course, it is incredibly difficult. There are so many people still dying. You know, and we have to look at the mental health of the people in our care homes. You know, that's another really important issue. These people have been locked down for a year with no access to their families. And I really think, you know, if we have to wait until the people in care homes have been given their second vaccination, until their families are allowed access to them, that's too long. And we really need to look at easing the lockdown restrictions and visiting access to our loved ones.
Jo?
Well, I think there's 2 points, really. I don't think statutory sick pay being enforced is actually going to encourage people to self-isolate. Statutory sick pay does not cover most people's normal weekly bills. So I think that's a moot point. And I think in terms of the lockdown being eased, yes, we need to do it in a measured way. And I think telling people that it's going to be lifted in such a short space of time gives people false hope. And I think that adds to people's mental health issues. It causes anxiety. We just don't know what's going to happen and when.
Colette?
Boris Johnson says we're following the stats and not dates. I'd like to ask something really important. Are we finally going to get in our third lockdown a transparent roadmap from the government that actually everybody can actually follow and not play the hokey-cokey anymore?
Well, the date we'll find that out is next Monday, Monday the 22nd, whether we're playing hokey-cokey or not, as you so brilliantly put it. Linda, should lockdown end following vaccinations of the top 9 priority groups?
To go back to Will's question, yes, Fiona. So I think I just wanted to strike a cautionary scientific note. The 2 things we don't know about these vaccines. Vaccines are hugely important, but they are not the only solution. We don't know whether they prevent transmission. And the other thing that we don't know about them is whether they are going to have to be changed in future. And we have to reduce the incidence and prevalence of the disease in the community at the same time as rolling out the vaccines. And the reason why we must do that is one of the reasons why all these variants are popping up around the world is because we've given the virus a chance to change as it spreads across the population. And what we're risking is what we call an escape mutant, which will really threaten the vaccines we have now. So those are things to recognize. And that means that the public health response, which is, as speakers have already said, the test and trace, the better support to isolate, those need to be maintained. So I can see a roadmap ahead where from March, actually, you will gradually start to ease, but you need to do it very slowly and cautiously while getting down to really, really low levels of infection in the communities. It's going to be those 2 things, vaccine and the continued, and I hope, much more robust public health response that's going to provide solutions.
So when you have the head of NHS providers, Chris Hobson, saying that restrictions shouldn't be lifted till infections fall below 50,000. At the moment, we're something like 695,000. I mean, that sounds like an awful long way off.
It does, but I think you can do. I mean, I'm not a big fan of the word lockdown, because what you're actually going to be doing, what we're having now, is a set of restrictions that are actually already going to be eased, because some children are going to be returning to the classroom, which I think will have an impact on the R, but not a huge one. I think we're going to see guidance on care home visiting. I think we'll be able to meet a smaller number of other people outdoors. Those are all changes we're probably going to see in the government's roadmap. So I think the NHS providers, their main concern is we must not move too quickly, because if we do and infection spreads, there's going to be more people in hospital, and that affects not only the mortality and morbidity from this disease, but also it has a huge impact on the thousands of cancer patients, over 40,000 cancer patients who have not started cancer treatment in 2020, and many other conditions that were untreated because the NHS is under pressure. So that's what the NHS providers, I think, the main point they're trying to make.
Peter?
Well, lockdown has a huge impact on everybody, and in particular on my industry and travel and tourism and events and so many others. And we want to see an end to this. We were promised that the Prime Minister would follow the data, but I mean, you know, it seems now he's starting to remind me of the kind of, you know, Greek god Morpheus, who was able to kind of alter reality and change shape at will, because we were told that the vaccine was our way out, and now we're told, well, maybe it's not, or it'll get longer. You know, it's clear that by Easter, the people in the vulnerable groups will all have been vaccinated. The vast majority of bands 5 to 9 will have been vaccinated. It's time to get on with it. So let's get the schools open on March the 8th without fail. It's causing huge damage to the children. It's putting pressure on the parents. My oldest son has autism, and I remember when he was young, it was how difficult to look after him, and the school was the kind of only relief that we would get as a family. And, you know, I was talking to a lady the other day, a single mother, 2 children, one of them autistic, lives in a 2-bedroom flat with no garden. She's having a terrible, terrible time. And there's all the health issues that people have mentioned. Lockdown causes damage. So let's get schools open by the 8th, non-essential retail and hospitality with some restrictions open for Easter, and let's get the rest of hospitality and everything else open in May and get on with it, because it's time to do it. The vaccine is protecting us.
Donna?
I completely agree with Linda. I think we need to have a very safe and measured approach to opening after lockdown. I think we also need to learn from the lessons that went with the initial previous lockdown, the mistakes that were made. These new variants have been given the time and allowed the capacity to mutate, and we really don't know what the effects of those are going to be, and we don't know whether or not the vaccine is going to work against those. We cannot allow this virus to rule us. We have to try to rule this virus.
Gary?
I think that we'd all agree that the vaccination programme has been really, really successful. And what we need going forward is the test and trace and the testing of people to come up to those standards as well before we can actually really move on.
Dave?
Yeah, it's a very difficult one to obviously try and equate. I'm very much with Peter, because working with and supporting young people that I've done throughout my career, the need for young people to actually be able to engage, to help with their personal social development has not occurred over the last 12 months. I work very much within the outdoor sector. Outdoor centres have been closed for nearly 12 months. Those centres can help with the mental health of young people. And it is really important that, yes, we take a measured approach, you know, to actually the relaxation of some of the restrictions, but also taking into account what lockdown has actually done for the health and mental health of society, and particularly for me, for young people.
Amanda?
Thank you. I think it's a good thing that you know that we're looking at schools going back, but I think the important thing is that now a majority of the elderly and the vulnerable are either vaccinated or are being vaccinated, that perhaps teachers should be given the priority now, not just teachers and training assistants or teachers' assistants that are with vulnerable children, but giving them the confidence, because if any of them catch it, then the schools have to close anyway if they lose all their staffing. But as for opening everything up and the lockdown, I think perhaps it's, you know, a lot of people are getting used to wearing masks in shops that are open. A lot of the supermarkets are now insisting that masks are worn, come what may. Perhaps it's time that for a short period of time, we have to wear masks when we're just outside. Then people who are starting to socialise, they tend to forget, they get close, they never stay 2 metres apart. Even if they go for a socially distanced walk, they always end up within 50 centimetres of each other, if not closer. So perhaps people should wear masks outside all the time.
Layla, let's there's quite a few points here that I'd like to address, but let's get back to the original question first, which is, should lockdown end following the vaccination of the 9 priority groups? And, you know, Peter makes a point, we were promised that vaccines was going to be our way out of this.
Well, I do hope that this is all going to go away as quickly as possible. I'm sure everyone at home and everyone here is just completely fed up with this. And I can understand why there is this temptation to think, well, we've vaccinated the elderly, we've vaccinated the more vulnerable, why not? Let's open up. The problem is, we've already spoken about the variants of concern. There's already one, the P1 variant, that we are very worried about. There was an area in Brazil that had this variant ripped through it. It actually was estimated that 80% or so of the population of this area had the original variant, and this new variant that has originated from there has reinfected that population. That's really concerning. And it's possible that one of these new variants, of which we grew one, the Kent variant, you know, the reason why we had one here is because we had such high rates in this country.
So this is an argument for vaccinating everybody then, before we lift the lockdown, is it?
I personally think we need to keep it slow and steady. And where we've gone wrong here...
So Mark's suggestion of once the top 9 priority groups and the vulnerable are vaccinated, lift the restrictions
I think it's right that we send kids back to school on the 8th of March. I think we need to vaccinate our teachers. They deserve that peace of mind. It's worth saying schools have been open throughout this. A quarter of primary school students already there. And that lady who has the autistic son, I would hope that he has an education and healthcare plan and that he's been able to go to his special school or his school. He should have been allowed to do that already. So I think it's really important that that happens. But after that point, slow and steady wins the race. I think Colette described it as the hokey-cokey. We have to end this boom and bust of lockdown, unlock. For businesses in my area, of which one of your pubs, Peter, is certainly one of them, it's the opening up, closing, changing.
Yeah, but Peter's arguing for opening sooner rather than later.
So I think we need to take it slow and steady. And the only time that we can confidently unlock completely, and there's an argument for actually saying, guys, we maybe need to get used to some form of coronavirus restrictions being around, I think, probably for the rest of this year. But that is not the same as unlocking or locking. What does that mean? You know, we've got kids going back to school. We're going to be able to walk, hopefully, in parks. Does it mean when hospitality opens again? Is that unlocking? So this word unlocking actually itself means so many different things. I think these big national lockdowns, this is the last of it. And Boris Johnson, by having 3 now, this is the third strike and you're out. This has to be the last big national lockdown. And you do that by taking it slow and steady. R cannot get anywhere near one again. You have test, trace and isolate. And to Nadia's point around statutory sick pay, I actually think we need to go further. I think we need to pay people to isolate. And in countries in the world that have got on top of this virus, and there are countries who are looking at us and going, why aren't you doing this? That is what they are getting right. They are paying people to isolate. They're encouraging people to do it, supporting them, giving them hotel rooms if they live in houses of multiple occupancy. And that's how they're achieving high rates of isolation, cutting those trains of transmission and getting on top of the virus.
Can I just sort of tackle because I'm interested in the sort of variant issue. I mean, the problem is the Chief Scientific Advisor has said that coronavirus is endemic and is going to be with us forever. And the problem is, if you take the view that there might be a variant of it at some point and viruses mutate, and there might be one that the vaccines don't deal with, at the moment, I understand the vaccines deal with all of them, that's an argument for never removing restrictions, ever. And I just don't think that is sustainable. We've got in this country a fantastic operation to map the genomic sequences of the variants, to change the vaccine to respond to them. And I think that's how you've got to deal with it. And I think it was Martin, forgive me if it wasn't, who asked about what's the acceptable level of death, or the level you can live with. And in fact, Angela McLean, who's the Deputy Chief Scientific Advisor, raised this, I think, in the House of Commons yesterday, and said they want ministers to have this debate and give them some guidance. We do it with flu. You know, each year, sadly, quite a significant number of people die from flu, and we don't shut down the country. And I think that's a good debate to have.
Well, an awful lot more people have died from COVID.
No, absolutely. But what I'm saying is, once you've vaccinated people, the groups that will have been vaccinated by government's target end of April, probably a bit earlier than that, they account for 99% of the number of people that have died. But once you've done that, you are in that sort of flu territory of numbers, and we've got to then make a judgment about it.
Let's put this to Linda, because Linda, this is your area of expertise. Are you convinced by is Mark right?
So first of all, Mark, we're not confident that all the vaccines that have been licensed for use yet are going to be fully effective against all the variants that have emerged. So that's a really important cautionary note to strike. The second one is, I don't understand the argument that it doesn't matter about the variants. I disagree with that. I think it's absolutely achievable to suppress the virus to a very low level and minimize the risk of lots of variants popping up, because re-vaccinating vast numbers of the population, even only the top 4 groups, is a huge logistical undertaking that requires NHS staff to come forward who may be better served doing other activities. And it's very costly as well to the public purse. So suppression or getting down to very low levels is achievable if we ease gradually, and crucially, that we keep an eye on our international borders and we maintain quarantine and other measures that are going to be needed so we're not importing variants. During 2021, we have to be really, really cautious, and to rush ahead and to open many things quickly all at once, there will be more preventable deaths.
I don't think the end of April is very quickly, though. It will mean that we'll have had a lockdown for 4 months. So that's the whole point. If I was arguing that we should unlock everything tomorrow, you would be absolutely right to say that was a rush. The whole point is, you're waiting till you vaccinated the top 4 groups and the vaccines have kicked in. It's March the 8th and we bring the schools back. And then, well, let me just finish and then you can come in. And then once the top 9 groups are done, you've got the bulk of the risk.
You've made that. Yes, you've made
but
that.
on the variants point, I don't think, in answer to Linda's question, I don't think the variants are something we shouldn't worry about. All I'm saying is, if you say, because there might be a variant, and there might be, and it might be one that comes from another country, you've got to keep the country locked down, then I just don't think you're ever going to get out of this ever, and I don't think that's an acceptable answer.
What about long COVID? I mean, that's the other thing that I wanted to ask about your plan, because it seems to only suggest that, you know, you have coronavirus and you recover, and there is no sort of in-between, but actually now there is mounting evidence. Just today, the government's announced more research funding for it. The Americans have earmarked $1.15 billion in research funding towards this, and we're calling for the all-party group on coronavirus, a compensation scheme for frontline workers who now find themselves in a position where they've had long COVID, can't go back to work, and face potentially not being able to earn a living. This needs to be counted in this scenario. How do you account for the fact that you are as likely to get long COVID as a younger person as you are an older person, Peter, in your plan?
Peter. At a final point, in terms of unlocking the economy, I'd just like to point out that when hospitality reopened last July, cases continued to fall for 3 months.
That's not true.
It is true. It's absolutely true. Case rates, deaths and everything fell from July the 4th, and it fell all the way...
Sorry, Peter, you're wrong.
They didn't.
ICU admissions went down, but
death
the cases were going... Yes, death rates did.
Death rates did, and that's measurable because, of course, the increase in positive cases was because they were increasing testing. So it was a really difficult measurement.
The ONS study...
But what's absolutely clear is hospitality was not a key driver of transmissions. It's been proven time and time again. We've had directors of public health say it. You know,
well, hang on.
I've got 28 pubs, 1,000 people. Not one of my employees became ill with COVID, not one.
All right, I'm just going to, Linda, you're shaking your head, and given that you are a professor of public health, I want to move on to another question, but do you just want to answer what Peter had to say?
So, I mean, Peter, so first of all, Peter, the impact on your sector has been huge, and unemployment causes huge health harm. So I just want to recognise that. But I just wanted to mention a couple of things. We didn't actually have a steady fall in cases during that period. You may be speaking about a reduction nationally, but we never managed to get numbers down to very low levels. And we did have areas in England, particularly, where those case numbers never really fell significantly. And as Layla says, hospitalizations and death. Is hospitality a risky area? I don't think it's more risky than many other indoor environments, but indoor environments generally are risky. And you can see, I mean, Aberdeen is the example that I would give you. Unfortunately, we had an outbreak in Aberdeen that caused a 3-week sharp lockdown that affected over 200,000 people as a result of a couple of folk who were infected going into hospitality and in fact visiting several venues. That was really unfortunate. It's not the sector's fault. With good guidance, things can be run really well, but indoor environments are more risky than outdoors. And when you have high rates of infection in the community, it just means that those kinds of venues are not risk-free.
OK, I'm going to take another question now from Tony. Tony Cowan.
Good evening, Fiona. Good evening, panel. My question is, to combat the spread of COVID, should the government now promote a policy of no jab, no job, and particularly in a healthcare setting?
Well, we'll come on to healthcare setting in a moment, if you would, but I thought I'd ask you that, Peter, given obviously that you're running a chain of inns, of pubs. No jab, no job?
I feel deeply uncomfortable with that as a principle. And I really could not imagine that I would do that to one of my team. I don't feel it's right. I'm hugely in favour of the vaccination. I will encourage everybody I speak to in any way I can to take the vaccine. It is safe. It is what the country needs to do. But to force an individual to do it or to threaten them, I'm sorry, I'm not comfortable.
And what about if you're taking on new staff? Would you want to require that of them?
I'm not sure I would. I think you'd have to think about it because it is a slightly different context. But generally, I just don't like the idea of people feeling forced to take vaccine. I think people who don't want to take the vaccine are wrong. I disagree with them. I would like them to take the vaccine. I'm just thinking it might be a competitive. I mean, I hesitate to use the word a competitive advantage, but I mean, you might find that your competitors are doing it, and you might. But, sometimes in business you have to look at principles as well as profit, and I'm instinctively uncomfortable. I would need an awful lot of persuading, and I really can't imagine that I would become comfortable with such an approach.
Layla?
I think that should be completely out of the question, actually. Because
even in a healthcare setting,
well, the thing is, we have to look at healthcare setting, which I presume includes social care. A third of social care workers are still not yet vaccinated, even though they are able to get it. And when we heard evidence about this from care workers and care workers staff, managers, about what was happening there, actually there's disproportionately large numbers of black and minority ethnic workers who are social care workers. There is vaccine hesitancy. And the way that you get round this, if people are hesitant to do this, and the other issue, by the way, is that they couldn't get time off. They were worried about taking time off in order to go get the vaccine. How perverse is that? So if you are in a situation where actually you're going to end up discriminating against people who, they've got reasons why they are hesitant.
But do you think, say for example, it was your elderly mum. I'm just playing devil's advocate here, but you had a choice of 2 care homes, and you thought, well, that one everyone's been vaccinated, and in that one everyone hasn't. But this is why I just think it needs to be the government needs to say this is the approach we absolutely do not want. And then there's also a private. I am a liberal. And my view is that actually you can trust individuals to do the right thing. And in this case, actually what you're asking them to do is to divulge medical data as well. And I don't think that's right. A vaccine passport, or however it's been called, or no jab, no job, or whatever, actually is putting so much onus on that individual. Often there are things out of their control that means that perhaps there's reasons they haven't had it. Not least, they might be too young and they actually haven't been offered it yet. It's not like it's a choice. You offered it in line. Let's hear from our audience. Claire.
it's not just young people, it's pregnant people. I mean, at the moment, we've got patient-facing nurses who are pregnant. They're not being told they need to start maternity leave till 28 weeks. The vaccines aren't licensed for them. No jab, no job is not realistic. I've jumped all over my first opportunity to have mine, as has pretty much everybody else I know. And I think there's huge goodwill amongst healthcare staff to get this done, not just for our sakes, but for our patients.
And Claire, can I just make sure we've got that, Claire, I hesitate, because you work in the NHS, but just in terms of people listening, want to be completely sure we've got that right. My understanding was that pregnant women have been told, if they're advised by their doctor, they can have the jab. Are you saying that's not the case?
Very few medications are licensed in pregnant women. And I think there's a cautionary note about this. Most of the pregnant women I know and come across don't want to put anything into their bodies that hasn't been shown to be safe in pregnant women. Now, this is a new vaccine. So certainly what the NHS is recommending to its staff is to become non-patient facing after a certain point in your pregnancy. But it's not just that. There are people with medical conditions which we're now finding out may be worsened by vaccines. And we're having discussions amongst ourselves about patients with blood disorders which may be worsened by some of the vaccines. So to make it one size fits all isn't appropriate. We are patients too.
Ryan.
Thank you, Fiona. I actually agree with a lot of what Layla said, actually. I think mandating anything is almost always very dangerous. I think she made a very important point as to asking the question why individuals sometimes feel nervous about taking the vaccine. And it should be more a case of trying to encourage people. Everyone I know who's a healthcare professional, everyone I know who is liable to take the vaccine has taken the vaccine. But it's a question of asking why that lack of trust perhaps isn't there among certain individuals and certain demographics. And trying to target that root question rather than just mandating individuals to take something or mandating individuals to follow a course of action.
Amanda, I can see you shaking your head at that.
Sorry, I do actually agree that you shouldn't be forced. However, I know from losing somebody to COVID who was on a green ward very recently, I know that if, for example, I was looking at a home or a nursing home or an old people's home now, I know that I would probably ask the question, what is the percentage of your staff's uptake in having been vaccinated? And I know that goes against the grain, and I would hate it if somebody said that to me. But in the situation where my family are at the moment, that would be one of the first questions that I would ask. So, you know, I can see it both sides, but I can see that there will be peer pressure with some people having a bee in their bonnet, and that they want to know that information. And I think that's it may well cause problems, but I do think that's going to happen.
So Mark, we've got a number of companies. We've got Barchester Healthcare, which runs more than 200 care homes, are saying new recruits must be vaccinated unless they have medical exemption. We've got Pimlico plumbers. All new workers will need to be vaccinated once vaccines are widely available. What's your view on no jab, no job?
Well, I think actually I'm broadly in agreement with the panel that have spoken so far, which I don't think is a very good idea. I think internationally, other countries can make requirements, and I don't think.
What, a sort of vaccine passport, if you want to international
in
travel?
the genuine sense of passport, because I think internationally, but domestically, I think requiring people to have or disclose their vaccination status, I think is a very bad idea. I think if you're talking about encouraging healthcare workers, I think you need to try and persuade them, understand what the barriers are. But I think it's also particularly ironic that I've heard it being argued as a way of getting the economy open. Well, the reality is younger people will be the last people to have been vaccinated. They're the ones that have been damaged most by the economic dislocation from COVID. We'd be in the ridiculous position where we'd be opening the economy and younger people would be the people shut out as older people were able to go back out again. I think it would be appalling. It's discriminatory. You do have to, I think the government's going to have to do something though, because I think from what Layla mentioned and what you said, Fiona, companies are going to start doing things themselves. And I don't think it's sensible to force individual members of staff to have to start taking businesses to court to prove discrimination.
So should the government step in? Do you think it's sensible for the government as the Justice Secretary suggested the other day, sort of leave it to the companies?
Well, the government has said that it doesn't want to have vaccine passports domestically.
And should it just leave it to the companies?
Well, and I agree with the Prime Minister when he said we don't live in that sort of country where you have to show your papers. But I don't think the government can just go, we'll just let people get on with it, because that way you are going to have some people doing it. And then what you do is you put the onus, on the person that hasn't been given the job or has been asked inappropriate information. You're going to have discrimination against pregnant women, as Claire said. And I just don't think it's sensible to put the onus on individuals. I think the government we should debate this in Parliament. The government should put forward a proposition. We should make a decision, and then everyone knows where they stand. I think that's the best way of doing it, rather than dumping it all on individuals to have to fight all those battles themselves.
Linda.
I think there's a good literature on this kind of thing now. In fact, the Ada Lovelace Institute released a really interesting report yesterday on the idea of vaccine passports and certificates. Actually, I think everybody's made really good points here. What I would expect in the future is that it will be required in some form for international travel, just in the way if I go to some parts of Africa, I need to show, or other countries, that I've had a yellow fever jab. So that's the first thing. And there are real concerns about discrimination, not just the very good point Mark just made about younger people entering the labour market and they won't yet have been eligible for a vaccine, but multiple groups who may not be able to show for whatever reason that they've had it. So it's not a precedent we have commonly in this country or many other countries. And I think it's important that the government does step up and have clear frameworks around it, and to emphasise all governments around the UK actually, so people know what to expect.
Hannah, you've got your hand up.
Hi. We spoke in the first question that the vaccine doesn't stop all transmission. So even if you're vaccinated and you have a no jab, no job policy, you're not actually, you might be limiting transmission, but you're not eradicating transmission.
Correct.
So it's a very arbitrary policy. It feels very authoritarian, and you're not actually going to solve the issue of transmission. We need to limit the cases that are in the community, and that will then bring down deaths and bring down hospitalizations with it. It will, eradicate it through limiting the numbers.
Tim?
Is this not a question that we need to address when everyone has been vaccinated? As in, looking at it now doesn't really make a lot of sense. But once we've all been vaccinated and we know who's left, then it needs to be a question. And I do think the government needs to step in and do something now with businesses, because otherwise, when businesses start doing their own things, as a business, we could be in a position where by not doing something, if something happens within our business, we're then taken to court by an employee. So the government does need to step in sooner rather than...
Tony, you asked this question. What's your view?
I think my view is very clear. I'm in awe of the National Health Service. And I think everybody would agree that far too many doctors, nurses and support staff have lost their lives trying to save the lives of others. And therefore it seems sensible to me, and I did say in a healthcare setting, that if we can protect those people as doctors, nurses and support staff, of course they should be vaccinated. I think it comes down to leadership, and I think the leaders in the National Health Service should insist, well, not perhaps insist, but make it so very obvious that being vaccinated will help to save their lives and probably save the lives of others at the same time.
So Nadia, no jab, no job. That's what it would come down to.
What the government has actually said on no jab, no job is that it's up to employers. Now, this is absolutely wrong. No worker, no person should be at the mercy of their employer. So the government, they clearly haven't shown the will, but they need to intervene to legislate against this. We cannot have a situation where employers are able to have a blank cheque to exploit workers in this way. And when we're thinking about vaccination passports, as Linda said, I think it's perfectly reasonable to have to show in the same way that if you were, going to a country in Africa, for example, that you had your malaria jab, that you've had the COVID vaccination. But when we're talking about documentation and people carrying that around,
so why is
the
it
people
different,
that is
Nadia,
going
for travelling?
The people,
I'm just curious, travelling abroad, if there's
you
a principle you have to have
If I can just finish the point, because it will be clear. If we're talking about people carrying around vaccination passports, the people that is going to impact are not white middle-class people. It's going to be ethnic minorities, people of colour, people who are already disproportionately targeted by police stop and search, people who are perhaps have insecure immigration status. And that's why, in my view, a vaccination passport should be completely out of the question.
Unanimity on the panel.
Hallelujah. Harmony has broken out, my
Very
goodness.
different views,
And amongst the audience. Well, let's see if it lasts for the next question. Come on, Hannah. Let's see if you can set the cat among the pigeons with this one.
Try. Is free speech at universities a current priority given the coronavirus restrictions?
Right, well, let's put this in a bit of context. So the Education Secretary, Gavin Williamson, is proposing a free speech champion who will investigate potential infringements of free speech in higher education, and universities could lose funding if they don't comply. It's not entirely clear yet, but that's the general gist of it. Layla.
So the question was, should this be the priority? Absolutely not. And let's call this out for what it is. You know, this is a purposefully divisive policy that is being put there as a distraction to everyone because Gavin Williamson has proven himself to be the most inept education secretary that we could possibly ask for throughout this pandemic. And I would much rather that if Gavin Williamson wanted to talk about free speech, he used it to apologise to all the students out there that he has completely failed in his inability to tackle this crisis. So I don't think this is the right priority at all.
Well, you've made your views completely clear. Mark?
Well, I think there's two parts.
This is coming off the back of a number of instances where people have not been able to speak at university.
Two parts to Hannah's question, really. There's the general, is it something that needs fixing? And I think the answer to that question is yes. There have been examples, both of academics and students, where they've either been discriminated against because of their views or because they haven't felt comfortable to express their views. And it was picking up Layla's point, it was a commitment we made in our general election manifesto. And as a whole, I generally think parties should keep the promises they make in election manifestos. Clearly at the moment, in terms of your point, Hannah, about the priority, clearly at the moment, my priority would be getting university students back to university when we can, so that they can do their studying. But I think we've made some announcements and we're going to implement this free speech champion. So I'm pleased we're dealing with it. I don't think it's at the top of the government's list of priorities. We're clearly putting a huge amount of effort into getting schools back on March the 8th, which is what I hope the Prime Minister will announce on Monday, and putting all those things that we need to put in place to enable children to catch up and for students to catch up as well on all the damage to their education, so that younger people and the younger generation don't have their prospects damaged. But I do think there is an issue to be fixed.
And why I mean, looking at the numbers, I mean, looking at this has come from the independent watchdog, the Office of Students. Less than 0.1% of speaker events were cancelled at universities in 2019, 2020. So why do you think, as you say, it clearly is an issue? Why do you think it is?
Well, I don't think it's not just, my understanding is it's not just speaker events, it's also about academics who feel they're not able to set out their views at university if they don't happen to be of the prevailing wisdom. Students are feeling that as well, and we had some examples, I understand. I think Matthew Goodwin's documented some of them around people that were pro-Brexit in an environment where it was largely Remain and were discriminated against because of that. So it is a problem that needs fixing, and we made a commitment to fix it. But clearly there are some other massive issues at the moment on education where I think we need to put a huge amount of effort. And as I say, we've talked already about the most important one, which is getting our young people back to school on March the 8th, because otherwise, their education, and not just their education, their social development's been so damaged. And that's what I want the government to commit to next Monday when the Prime Minister makes his statement.
The evidence is that this isn't a widespread problem on campuses. Let's be clear about this. This is the government's agenda to stoke a culture war, to distract from the huge issues that are happening. We have 119,000 deaths in this country. People's mental health is suffering. I'll tell you what the issue is in education. It's the fact that higher education has been cut to the bone by this government, that people of my generation are having to pay extortionate tuition fees and are saddled with debt, that the teachers who are delivering this education are on insecure, precarious contracts, many of them hardly able to even make ends meet. So let's not get drawn into the Tories' culture war here. We've got to be very clear that we have to target the issues that exist. And if the Tories really cared about education, then you wouldn't see Mark Harper, for example, who voted to cut EMA, something that many people were relying on to go to college.
Does the education maintenance allowance you're talking about?
Yeah.
And so when you hear about, I mean, Hannah's asked this question because a number of cases have, I'm assuming, Hannah, putting words into your mouth, but there have been a number of cases, for example, the former Home Secretary Amber Rudd, who was disinvited at half an hour's notice from speaking at Oxford. There's an Oxford University professor has had threats made towards her, has to walk around the campus with security guards. Do you think that's a kind of sideshow, or do you think that is something that is of concern?
I think it's important to say that I'm a proud defender of free speech, but there is a difference between freedom of speech and the right to speak freely and the right to a platform. Now, nobody has a platform. I don't have a right to be on Question Time tonight, and I'm not going to sue Question Time for not inviting me on.
Well, there's
nobody
a relief.
has a right to a platform.
I had no idea that was even in your mind, Nadia.
But that's exactly what this would do, is it would undermine the independence of universities and other institutions and enable people to sue universities for not having a platform. So where do we draw the line on this? If ISIS or neo-Nazis don't get invited to speak at universities, is the government going to give them compensation? And if the government really cared about free speech, then why did we see the government supporting moves not to talk about the pros and cons of capitalism in school and supporting moves to ban talking about racism as a structural issue? This has got nothing to do with free speech. This is about distracting from the real issues, the fact that 119,000 people are dead because of this government's incompetence. And if we lift lockdown too soon, we will be going into another lockdown.
I know you want to come back on that, but let me just get around the panel and see what the audience want to say. James.
Look, free speech is important, but the real issue at play here and the biggest threat to education is Gavin Williamson. He's universally the worst health education sec we've ever had. And this is just another top-line Conservative with headline-grabbing hot air. It is absolutely not, it's unequivocally important that free speech is the issue, but the biggest threat to education is Gavin Williamson. He needs to get out, stop grabbing big headlines and crack on with doing his job better.
Colette.
I absolutely support what was just said. I'm sitting here laughing because, it's not just the education, but, education of schools, universities. I live in Nottingham and, there's been no guidance given to students. We're the student party capital of the country. But more importantly as well, absolutely, Gavin Williamson, step aside, please, because your apprenticeship programmes and everything there has all been completely let down. We have 26,000 apprenticeship positions at risk in our sector, and we can't even apply for Kickstarter schemes. So there you go. Step aside, Gavin, please. Let somebody else do the job properly.
Linda, let me come to you, because you're Edinburgh University. The question is about free speech. Is it a priority? Is it an issue as far as you're concerned?
I don't think it is a priority. There was a 2018 report from the Parliamentary Human Rights Commission which showed that there were instances that were concerning in universities, but it was not a substantial issue. I can understand that when there's a commitment in a manifesto, governments want to take it forward, but we are in a global crisis. We're in a UK crisis. There are far, far more important things to be dealing with. Both the University and College Union and Universities UK have said very clearly that they don't think this is a priority and they think we have mechanisms to deal with it. I'm sure there have been a number of unfortunate incidents, and things like bullying and academic staff not being properly treated is very serious, and universities take that very seriously. So we need to have the right systems in place to deal with this. But just a couple of other points, Fiona, to bear with me from the audience and from Mark and others. Universities are not shut. Universities are open, and university staff have been working incredibly hard to teach either in the way they normally do or in completely different ways. But university students have been badly affected. I do agree with that. And the rush back in the autumn, and mistakes were made. And I think one of the panel was asking there what's happening for September. There's very intensive planning underway to try and make sure we can have some students back, but to do that in a proportionate way, and also make sure that they have good access to testing where that's appropriate. So we're planning ahead, but I absolutely agree with what others have said. This should not be top of anybody's priority list at the moment.
Peter?
Well, it's nowhere near the top of mine, and I guess there's a good reason why in pubs we don't like people talking about religion and politics. I mean, in general terms, you know, I believe in free speech. I don't like, you know, the sort of cancel culture type thinking, and in many ways, I'd quite like to know who the bigots or the racists are, so I could tackle them and argue with them and everything else. So, I know it really isn't a key thing keeping me awake at nights at the moment.
Very briefly, because I want to come up to another question. Would you like to defend the Education Secretary, because he's had a bit of a kicking?
Yeah, no, I noticed that. No, look, I don't think it's fair to say that he's spending all of his time picking up Hannah's point about focusing on this particular issue. You know, the vast majority of his time is focused on what I've talked about, which is getting children back to school, so all children can come back to school on March the 8th. And I know there's a huge amount of work going on in the Department for Education to make that happen. That is the top priority for the department. And I hope the Prime Minister will confirm that on Monday. And then ministers in the Education Department, including the Education Secretary, are then going to put their shoulders to the wheel to make that happen so that our kids have the best possible start in life. And I know that's what he wants to do. And that's what the team of ministers at the department want to do.
Let's have a complete change of subject now. We haven't got an awful lot of time left. Brian James, you've got a question for us.
What should we do about Harry and Meghan? Why do they feel they can reject the trappings of royalty here for a private life there, but then use them to build a commercial empire?
So, Meghan in particular has taken on a number of projects, voiceovers, and working with documentary companies like Netflix, for example. I mean, what do you think, Brian?
I think that if they really wanted to help people generally through charitable work, I'm sure Harry's family would back them, along with many philanthropic Americans. But sadly, this isn't what they have in mind. They seem to be much more interested in the celebrity circus. So an hour or so talking twaddle to Oprah fits perfectly.
Right. Well, they certainly don't seem to be getting your vote, from what I can see, Brian. Nadia.
I'd firstly like to extend my well wishes to Prince Philip, and I hope that he makes a speedy recovery. With regards to,
as I'm sure we all.
Yeah.
With regards to Harry and Meghan, I just think that this is not a priority issue. These are two young people who are getting on with their lives. That family knows what it's like to be harangued by the media and the press, and I think they should be left alone.
Layla?
Well, to answer your question directly, what do we do about them? My answer would be nothing. I don't think that it keeps me up at night, or it's something I think about at length.
I mean, there's going to be a review announced very soon as to whether they should keep or lose their royal patronages, for example. Do you have a view?
No, I don't. I really don't. I can understand why Meghan and Harry left. I especially understand the social media pressure that Meghan came under. I think there was some quite overt racism in some of the abuse that she got on social media while she was here. And I think it's a really sad thing that they felt that they couldn't make that life that they wanted, that dream that they had, work in this country. That's maybe something I'd think about. But as to, you know, do they keep what title or whatever? No, don't really care.
James, you had your hand up.
Yeah, I just think, like, obviously, they must be really difficult for them. There's loads of social media pressure. They've wanted to step away, but then they want to step away and then publicly announce a baby. Like, which is it? Do you want to step away and live quietly, or do you want to blitz the media? You know, if they want to get on with their life, get on with it, crack on in private. If you want to be in the media, you know, do your public duty and be part of the royal family and get with the programme and do your job, do your duty, or go and live quietly. Don't do both.
Jo, you're shaking your head at that.
Well, I think that's a really neat way of putting it. They are in the public eye. They're trying to manage it as best as possible. I mean, quite frankly, I have higher priorities than worrying about Prince Harry and Meghan and their new baby. I don't wish them any ill harm, but let's face it, I think they're just trying to manage a situation in the best way for them and them as a family. And I really don't think anyone's got any right to criticise that. I'd much rather we focused on more pressing issues, like whether our children are going back to school, or whether our children are going to have GCSEs or have a future or get a degree at the end of 3 years. That's more pressing to me. And I really am not interested in that area at all.
Well, there are lots more pressing issues, but we cover the whole gamut of areas of interest here on Question Time, and that was a perfectly legitimate question by Brian. Peter?
I don't really care too much. I mean, to me, they're a couple of celebrities. I don't think they're very relevant to the royal family anymore. You know, I'm a big fan of Harry's grandmother, and I thought what happened to his mother was awful. But to me now, I wish them well. I hope they get on with their life and they find a way forward. But yeah, it's not of big interest to me. It's really not. To me, that they've moved away from their life here, and I hope they find a new life and a way forward. I think it can be irritating when people kind of want publicity on one day, but not the next. But equally, you know, when people choose to have privacy, they should have it.
Linda?
Well, surprisingly, Fiona, I don't have a public health perspective on this.
Come up with one.
What I would say is, again, just reflecting on the horrible year that we've been through, and everybody's struggled and had so many difficult experiences. I think we all need to look ahead to a period of recovery and just ask for more kindness and compassion for all of our fellow human beings, whether they be a member of the royal family or anybody else.
Mark?
3 things from me. I completely agree with what Nadia said about hoping that His Royal Highness the Duke of Edinburgh is able to return back to Her Majesty the Queen at the soonest opportunity. Great news about Harry and Meghan's new child. I think we all wish them well on that. And I suppose we're only dealing with this because Brian asked it. I think the relevant public policy question is just that one about, can you be a private individual and a member of the royal family at the same time? And I think I agree with what James said. They sort of need to make their mind up. And you either are in the royal family...
So how do you feel about the interview with Oprah?
Well, I think you either have to be in the royal family, and along with that come a whole load of duties that come with the privileges that you have, or you decide that you're not going to do that and you're going to go off and plough your own furrow, you know, in the world that you want to do. And they're absolutely entitled to do that, and I have no criticism of them. What I think they can't really do very well is you can't really do both. And I think the problem is, by doing both, trying to do both, that's what then brings them into the controversy. And I think probably it'd be better when this review happens, is if that's what they want to do, they just go off and do that. They can do what makes them happy and bring their kids up, live their lives, completely understand the sort of family history and understand why the pressure is difficult. I don't particularly have a problem with them doing an interview with Oprah, but I do think there is a sort of challenge with them being sort of celebrities and in the royal family at the same time.
Well, Harry and Meghan, if you're watching over in the States, that's the view from here on Question Time. Our hour is up. Thank you very much to the panel for coming here tonight. Linda, thank you very much for joining us down the line from Edinburgh. Great to hear your views. And, of course, the audience, our QT50, wonderful to have you on. We'll be seeing you again soon. I look forward to that. And to you at home, of course, thank you very much for watching from Question Time. Bye-bye.